We organized 2 years ago, on behalf of the EHA, a scientific working group focused on aging and hematology. It was not a disease-oriented meeting. It was more a meeting where we were discussing the biology of aging, how to tolerate the treatment when you are an older patient, the quality of life, the cost effectiveness, and this meeting was a success. Then we have decided to organize a second workshop, and this meeting will be between the 12th and the 14th of October in 2018. The person who should attend this meeting are everyone concerned about aging and hematology. Then the target audience is everyone, healthcare provider like clinician, geriatrician, hematologist, oncologist, nurses, pharmacists, but also we would like to involve the scientists, the research fellows, but also patient organization representative and even pharma representative. Then this meeting is very important for hematologists because 50% of the patients we see with malignant hemopathies, they have 65 years old or more than 65 years old. Our population is aging, then we are going to face more and more patients with malignant hemopathies, but we know also that a lot of malignant hemopathies, Hodgkin disease, diffuse large B-cell lymphoma, even some good prognosis, AML, they are curable. Then we have to teach hematologists how to select the patient, the older patient, who are able to tolerate the classical treatment and who can be cured. And also we have to teach how to protect the frail patient and to avoid aggressive treatment. The hematologist, no, I start again. Okay.
So this meeting has three key objectives.
Yeah. That's why I wanted to start again. Then this scientific meeting has 3 major objectives. The first one is for the participant is to get tools to identify patients able to tolerate the classical treatment and also to identify the vulnerable or the frail patient who should be protected from aggressive treatment. The second objective is to expand their knowledge in what's going on with aging and hematology in terms of biology, but also in terms of comorbidities, polypharmacy, and all the aspects of aging. And the third objective is to earn credits for the continuous medical education, and why not to become a member of the scientific work group on aging. What I learned by taking in charge all the patients is that the objective of the hematologist is not only to cure or to treat the disease when you have an older patient in front of you, but to take into account the patient, his vulnerabilities, and also his expectation. And that's what we would like to teach during this meeting. And it's important to teach, and mostly the young clinician, that they should not only take care of the patient, but when you are dealing with older patients, you have to take into account the vulnerabilities of this older patient, the expectation of this older patient. They are not the same at 90 years old and at 60 years old. The quality of life is more important than the quantity of life for this older patient. If you are a hematologist and if you are concerned of all the unmet needs in the management of older patients, then you can join us during this meeting to be held between the 12th and the 14th of October 2018. This meeting, the objective of this meeting is to teach you what a hematologist should know in the management of older patients and all these unmet needs. And please come to this meeting, join us. You will expand your knowledge, and we really count on you.